Okay, thank you. Thank you very much, and good afternoon, everyone. Let's get going. Ontario numbers, 1268 increase from the previous day. That's actually a decrease to the last couple of days trends. We've had 1,600 or so last couple of days ago, and so I was worried about that uptick. It's kind of stabilizing now, but it's still sort of on an uptick in general, week to week. I think we're getting a bigger increases as the weeks progress. Again, most of them are driven by GTA area. Ottawa had 57. In our area, I'm going to talk specifically now. We added, I just want to make sure I get this thing right because the last time I, here we go. Sorry, I'm just gonna, for some reason I lose my, I had already set it up, but anyway. So we added 21 cases, if I'm not mistaken, over the weekend just in the Cornwall area, and another 10 or so in the other two districts that we have, or two counties. Let me just look at the number. We're up to 167 total active cases. We're almost at 3,000 cases. We've got 15 hospitalized, including 3 in the intensive care unit. No change in deaths. We have 8 outbreaks, which is a bit less than we had last week. And we vaccinated way over 15,000 people, and I'll talk a bit about vaccinations a bit later. But if we're looking at the change of what we're seeing now, we're looking at, again, 21 cases overall. It's 35 over the weekend, over 2 days. And so 2 in Akwesasne, 21 in Cornwall, 6 in STNG, and 6 in Prescott-Russell. Again, a lot of these were cluster cases and some outbreaks and so on. One of the things that we need to be keeping an eye on closely is the fact that our rolling average seems to be really sort of going upwards. Cornwall now has started to stabilize, go down, but clearly it's way above red. Our overall numbers in the Eastern Ontario Health Unit is just below the red sort of border here, and so we're just hoping that we can move along towards the orange, not the other way, and hopefully, like I said, we'll see a trend in that direction. But clearly, you can see that we have an upward trend as compared to a couple of weeks ago. So I'm just going to stop a bit right now and just share a few other things regarding our cases. What we've been seeing now is, again, the situation has been that, and the rest of the province, that we're about 40% provincially of all positive cases have been mutation, the mutation, the VOCs, the variants of concern, and most of those have been in the UK. In fact, in our area right now, we have 40 VOCs, again, all over the Eastern Ontario Health Unit area. And just to give you an idea, on February 25th, our percentage of VOCs from our positives were 13.6%. March 1st to 7th, it was 27%. And now March 3rd to 9th is what we do previous 7 days. Was 28.4%. So 28.4% of our positives over the last week now have been VOCs, which again, the provincial number is about 40% in terms of those numbers. Now, I know that somebody had asked me in the media, in the questions here from the media before about VOCs and which type they are. The ministry has changed right now. When there's the mutation, the 5011 mutation picked up, they assume automatically it's the UK. If there's another mutation, that's a different type, a different number, I forgot the number, but if they do have that number, that mutation, then they would go and do the genomic sequencing. So in our situation, all but one were UK, presumably UK. So we'll keep an eye on that. But again, another reminder, very strong reminder that we really need to make sure that we follow the public health measures and understand that this variant actually transmits itself much more easily when a lapse occurs. So it's important. Although we know how we can contain it. Fortunately, when we had an outbreak in one of the one of the factories a couple of weeks ago with 3 cases. They were contained because we took action immediately. But again, if you lose track, if you lose control of them, they spread to dozens and dozens of people, literally, that we've seen across the province. So I think we're lucky in that regard, but we still have to be very, very careful moving forward with that. In terms of some of the other outbreaks that we've had of importance, the Woodland Villa, we're close to closing that in terms of the declaration of the outbreak. Again, we have 1 active out of the 50 initial residents that were positive, and 3 active out of the 19 initial positive staff. Again, support continues. The Palace, again, there's 2 active cases in residents and 3 resolved from the staff. And again, just continuing to go, through the protocols. Place Rideau continues to have 1 resident and no staff. And again, we'll just continue the protocol there. Chartwell, McConnell, again, we've had 11 active cases. None are resolved, 3 are hospitalized, and 9 out of the 11 there are VOCs. We've also had 8 active staff, and 6 out of the 8 were also VOCs there as well. In terms of positives. So again, we're doing testing, we're continuing to support and ensure that the measures are taking place so it won't spread any further. The remainder of the homes, with the exception of Heartwood, have no residents. Heartwood has 2 positive residents and 1 positive staff, which is a VOC. And again, we are doing sort of what we call enhanced monitoring when there's a VOC in place. In terms of schools, over the weekend, we added just 1 case from 1 school. So right now we've got 24 cases actually 24 cases in 21 schools. 1 still is an outbreak. Daycares, we do not have any outbreaks over there. And so let's talk about vaccines. So vaccines has been the topic of the day today. As you've heard, the ministry booking system went online this morning, and there have been multiple problems, not only in our health unit, but across the province. There were difficulties with being able to book, difficulties when once on the system. There were these, it was called form. There was a message that came out, tampered form, and it was an error message that came out. We have been in constant touch with the ministry. We've been working with the ministry all weekend, ensuring everything was in place. And it seems now that in our area, people can actually book for all our 6 clinics. We have 6 clinics slated for the 80 plus populations across Eastern Ontario. And now my latest news is that now people can book it. The other thing that we've added on our website, very importantly, is for the individuals that are in phase 1, because as you understand, the ministry booking system, you can book directly if you're 80 and over only. However, there are groups that we're still vaccinating, healthcare providers, community healthcare providers, and so on, and they can pre-register through our website. And then there's a way of putting them into the system. So that's so we can control who registers. So that is ongoing, and we developed a pre-registration system, and it's working very well so far. So we're going to continue with that, and as we open up to other groups, that's how they're going to be able to pre-register, and then we'll have access to an appointment. So at least right now, like I said, we had some news that it's been resolved. I'm not sure what the problem was, but again, it wasn't just us, it was multiple health units across Ontario that had some problems. And again, I was just told that it seems that now people can access the system and book in one of our 6 clinics for 80 plus. Now, speaking of clinics and vaccines, we have been given our allocations for the next month, and we will be receiving a steady allocation, and we will anticipate finishing phase 1 over the next 2 weeks, and then moving into phase 2, where again there'll be multiple groups and multiple types of groups being vaccinated simultaneously. we will have, so I know what, we know what our vaccine supply is. So we're moving forward, we'll be able to book them in advance. That's why when we start, and then when we're approaching phase 2 and not necessarily in phase 2, we might put a call out for certain groups to pre-register, and then we can give them an appointment. So have them listed so that we can give them an appointment once we're into phase 2 for that particular group. The other issue is that, again, we're just receiving Pfizer and Moderna. We should be getting even more Moderna than that has been allocated. So our numbers may even go up. So I'm confident that we'll be able to, given our numbers, we'll be able to go through phase 2 relatively smoothly. Again, it seems now that some of the kinks are being ironed out from the provincial system, and so hopefully moving forward we'll be able to get that. Just wanted to add as well that we do have 6 separate mass immunization clinics across the entire health unit. Cornwall, Alexandria, Winchester, and SDNG, Castleman, Rockland, and Hawkesbury in Prescott-Russell. And those are 6 large venues, which are large enough to be able to accommodate mass immunization clinics, anywhere from 4 vaccination tables to 20 simultaneous vaccinators, again, depending on the numbers and depending on the population. We're also going to be moving forward with, obviously, we've got partnerships with the hospitals. As a matter of fact, the Cornwall Hospital is helping us. It started a clinic today for healthcare providers, again, by appointment. We have a system there where we can triage them. Our other 3 hospitals are going to come on board quite soon. We have partnerships with our community health centers as well. We're also, like I said, going to be continuing our mobile clinics. As we speak, we are now finishing off the 2nd dose of retirement homes. And hopefully by Wednesday, we'll have done 2 doses for all retirement home residents and all long-term care residents, which is good news. So that then we'll be just focusing on our fixed clinics, which again, we will have multiple. We do have the mobile ability for individuals that are not able to leave their home. We will have home visits organized for them. And we're also going to be contemplating with looking at other small pop-ups in areas that we're not there with our mass immunization clinic. So we really want to, as much as possible, to be able to provide the vaccine and remove any barrier moving forward. So for now, moving forward, we want to do the 80+, finish with our home care individuals, and then go on to the next phase. And as we approach the next phase, I will be able to give you a bit of an update as to how we proceed to that and so on. So I think that's good news, and we're just well on our way to vaccinating as much as we can. For us, like I said, the rate limiting factor is not our capacity. It's not that our we don't have a plan in place. It's really the amount of vaccine that we're getting. So the more vaccine that we get, which seems to be now revving up, but at least being a stable, reliable one that we can build on. If the numbers change, they'll change upwards, not downwards. So I'm quite confident we'll be continuing with that. Again, in the interim, though, the bad news of that is that our numbers are going up in terms of our COVID and our 7-day averages. Again, please, very important. No matter we're vaccinating a lot of people. I know by the end of this phase 2, we'll have vaccinated probably close to 50,000 people in our area. As looking at our vaccine supply and numbers and so on, but we still need to be very cognizant of the fact that the VOCs are that dangerous. So it's the race against the VOCs, and I really would want that us to continue really being mindful of them until we have a substantial proportion of the population vaccinated, and so we need to be careful. Bon, bonjour tout le monde. Je vais commencer avec les chiffres ontariens. Non, rendu, on a augmenté de 1268 cas pendant la fin de semaine. En effet, c'est un chiffre qui est mieux que les jours précédents. C'était 1600 quelque chose à peu près. Donc, c'est une tendance toujours en augmentant à travers d'Ontario. On voit ça à travers d'Ontario. On voit que encore la plupart des cas se font à Toronto. Ottawa, il y avait 57. Et dans notre région, je vais partager mon écran ici. Nous avons ajouté cette fin de semaine une une trentaine de cas. Je vais juste vous donner exactement, je vais aller en français ici. Donc, nous avons ajouté pour que là, on a 167 cas actifs, presque 3000 cas, on a 15 hospitalisés, soit 3 sont aux soins intensifs. Attendez, je vais le chiffrer. Alors, aucun changement au niveau des décès. Au niveau des éclosions, on a 8, c'est moins que la semaine passée. Et nous continuons à faire des tests et on est rendu à plus que 15 000 et le chiffre va augmenter aussi parce que ça ne compte pas les vaccins qu'on a donnés la fin de semaine et aujourd'hui. Juste voir au niveau des cas que nous avons ajoutés cette fin de semaine. Depuis vendredi, on a ajouté 35 cas. Donc, 21 étaient de Cornwall, mais il y avait des flambées auxquelles on a eu au moins une douzaine qui comptent pour ça. 6 de chacune de Prescott-Russell et SDNJ et 2 de Aquasasni. Au niveau des moyennes mobiles, le chiffre qui est important pour nous, nous voyons que, surtout avec Cornwall, vous voyez, on est pleinement en haut de la région rouge, la zone rouge, mais on voit que ça commence à diminuer. Mais ceci est poussé par le fait qu'on a des éclosions. Donc, on a des cas ensemble, comme je dis, une douzaine ensemble. On voit à la moyenne, on est vraiment au bord d'orange, un peu plus bas que la zone orange, mais espérons qu'avec les diminutions qu'on voit à Cornwall, nos chiffres vont continuer à aller en diminuant et pas augmentant pour qu'on puisse rester à l'orange. Cette semaine, on reste à l'orange, mais comme chaque semaine, le ministère va faire une évaluation mercredi et jeudi et annoncer vendredi qui va rentrer ou qui va changer au niveau des zonages. Au niveau des autres spécifiques que je voudrais partager avec vous, c'est que au niveau du bureau de l'Est Ontario, on continue à avoir un taux augmentant des variantes. En effet, actuellement, nous avons 40 variantes et 39 sont présumées d'être la version britannique, UK. On est en train de voir, les laboratoires ont changé. Quand on voit le dépistage de mutation de 5001, on présume que c'est la souche britannique. Et les restants, ils font les évaluations génétiques. Donc, nous, la plupart de nos cas, 39 sur 40, étaient la souche de UK. Et au niveau des provinces, on voit que le pourcentage des positifs de tous les cas qu'on voit de façon quotidienne a augmenté et maintenant, c'est à peu près à 40 %. Dans notre région, le 25 février, on était à 13,6 % de tous les tests positifs dans notre région qui étaient des variantes. La semaine passée, c'était à 27 % et cette semaine, on est rendu à 28,4 % au niveau des pourcentages, comme j'ai dit tantôt. Et ça, c'est plutôt poussé par les variantes britanniques qu'on appelle. Donc, c'est un message pour nous de continuer avec prudence importante, prudence plus précisément des distances physiques et aussi les masques, etc. Parce que, à mon avis, ce sera très important de le faire actuellement parce qu'on voit vraiment que si on perd contrôle de ces variantes, ça peut augmenter de façon beaucoup importante, comme on l'avait dans les autres places. Heureusement, ici, on peut le contrôler, mais les chances, on peut perdre. À chaque fois qu'on oublie de faire quelque chose au niveau de porter des masques ou de rapprocher quelqu'un plus proche que 6 pieds, le virus prend avantage. Beaucoup plus facile à se faire transmettre que le virus original. Donc, il fallait qu'on fasse très attention. Donc, maintenant, la bonne nouvelle, c'est qu'on a des bonnes nouvelles, en effet, mais aujourd'hui, comme vous savez, le système de réservation pour les vaccins provincial a été lancé ce matin à 8 heures. Et comme beaucoup de monde, on s'entendait, il y avait des problèmes techniques. En effet, c'était difficile à prendre des rendez-vous, pas seulement dans notre bureau de santé, à travers beaucoup des autres bureaux de santé. Il y avait des messages d'erreur, etc. On travaille de façon étroite avec le ministère et ils sont en train de tout régler les problèmes techniques. En effet, sur mon dernier appel avec nos personnels ici dans le bureau de santé de l'Est Ontario, on a constaté que maintenant, nos systèmes marchent. On pourrait prendre des rendez-vous dans une des 6 de nos cliniques à travers de l'Est d'Ontario. Donc, ça, c'est des bonnes nouvelles. On va continuer de travailler avec une façon étroite aussi. N'oubliez pas aussi que cette programme de réservation, c'est seulement réservé pour des personnes de 80 et plus. Pour des personnes qui tombent dans phase 1, qui ne sont pas, de plus que 81, les travailleurs de santé, etc., on a un système de préenregistrement sur notre site web qu'on pourrait prendre et donner une code et donner un rendez-vous. Donc, ça va bien. C'est un programme que nous avons développé nous-mêmes. Et de ce sens-là, ça va bien. Et on va l'utiliser au fur et à mesure quand on va faire une expansion des personnes qu'on va vacciner dorénavant. Donc, semble-t-il que ça va mieux avec le système. Donc, on va voir. Je n'ai pas reçu notre rapport depuis 3h30 cet après-midi, mais à ce moment-là, semble-t-il que tout était beau au niveau du vaccin. Chose que j'ai oublié, juste à dire, au niveau des flambées, avant que je continue avec le vaccin, parce que je l'avais oublié. En effet, au niveau des flambées que nous avons, Woodland, Villa, on a une résidente qui est encore positive parmi les 50 et on a 3 actifs au niveau des personnels. Donc, on continue à faire un suivi. Palace, on a 2 actifs résidents et on avait initialement 3 positifs des employés. Maintenant, sont résolus. Au niveau de Place Rideau, on a une cas de résident. Aucun employé. Chartwell, McConnell, on a 9 sur 11 positifs au niveau des résidents sont les variantes et 6 sur 8 cas positifs chez les employés sont les variantes aussi. Donc, on continue à faire des précautions plus proches des expansions au niveau des mesures un peu plus fortes qu'on fait d'habitude parce qu'on a la présence de variantes. Au niveau des autres, la seule Artwood est à 2 résidents qui sont positifs et une employée qui est bien sûr le variante aussi. Donc, encore là, on continue à faire un suivi étroite avec ça. Les restants de nos flambées n'ont pas des résidents. Au niveau des écoles, nous avons ajouté une cas dans des écoles publiques dans notre région. Donc, on est rendu à 24 cas dans 21 écoles avec une flambée qui date depuis mi-février. Donc, en effet, ceci semble stable et nous avons quelques cas dans les garderies, mais aucune occlusion dans les garderies. Donc, on continue avec le vaccin. En effet, donc, on continue à faire. Nous avons 6 places assez grandes pour faire des immunisations masse pour beaucoup de monde à travers de notre région. À SDNG, c'est à Cornwall, Alexandria et Winchester. À Prescott-Russell, c'est à Castleman, Hawkesbury et Rockland. Et aussi, nous avons des partenariats avec nos hôpitaux qui vont nous aider. Déjà, à Cornwall, on commence nos partenaires au centre communautaire et à un moment donné, on va avoir des centres primaires et les pharmacies qui vont commencer. Nous avons aussi toujours les cliniques mobiles. En effet, nous allons finir avec les cliniques mobiles pour des maisons de retraite mercredi. Donc, on va avoir fini tous les deux doses autorésidents des maisons de retraite et des foyers de longue durée qui étaient faits il y a à peu près quelques semaines. Donc, ça, c'est des bonnes nouvelles. Et on va concentrer sur nos vaccins sur le place fixe. Bien entendu aussi, nous allons offrir des services à la domicile pour des personnes qui ne pouvaient pas transporter à nos cliniques. Aussi, nous allons continuer avec les cliniques mobiles si on a besoin d'aller dans une place où, pour une fois ou 2 fois, pour vraiment que ça soit vraiment disponible pour tout le monde, qu'il n'y a aucune barrière de recevoir le vaccin. Nous présumons qu'avec le débit de vaccins que nous allons recevoir d'ici 1 mois, nous pourrons, dans quelques semaines, facilement avoir fini phase 1 et de rentrer en phase 2. Et à ce moment-là, on va avoir des listes au niveau des personnes qui pourront être... Ça va beaucoup plus du monde, mais on aura beaucoup plus de vaccins Donc, à ce moment-là, aussitôt on approche, on va commencer à sensibiliser les médias et les gens aussi. Donc, bonne nouvelle au niveau de vaccin. Semble-t-il que le système commence à marcher. Le système de réservation provincial semble-t-il d'aller mieux. Ça marche mieux. Et on attend d'avoir pas mal de vaccins d'ici un mois et peut-être plus parce que nos allocations qu'on a reçues au niveau pour les prochaines 4 semaines n'ont pas inclus AstraZeneca et n'ont pas inclus une autre livraison de Moderna qui va arriver la semaine prochaine. Donc, toujours des bonnes nouvelles, mais encore, c'est une course entre les variantes qui commencent à augmenter à travers l'Ontario, non seulement dans notre région, et le fait qu'on pourrait vacciner, on va vacciner le plus vite possible, beaucoup de gens, le plus possible. N'oubliez pas aussi que il faut, comme toujours, même si on est vacciné, si on vaccine pas mal du monde, on n'est pas rendu au stade où on peut dire oui, on va enlever les mesures de santé publique. Il faut continuer pour le moment. Et en effet, je vous prie vraiment de partager le message de l'importance de maintenir toutes les précautions de santé publique jusqu'à nouvel ordre, parce que vraiment, ça serait très important. C'est de la course qu'on a. Et nous, on veut vraiment augmenter, gagner au niveau de vaccin et ne pas avoir. On va voir le chiffre de vaccins augmentant et le chiffre de variantes et aussi des flambées des autres indicateurs d'infection de diminuer. So I'm going to take some questions right now, that I've got from the media here. For those who completed a registration process at the Ontario website but did not receive confirmation of an appointment, what will happen next? Well, they will get notified. They will get notified to register if necessary. Again, we're waiting to see exactly what the issue was. Am I confident that the province booking system will be able to handle volumes? I think that it will. Again, I think there are growing pains. This is an unprecedented thing that's going on. Moving forward, I think they're going to get the kinks out, as we've seen today. When the variants of concerns first appeared, those mentioned, they will be included. Yes, they will be included on our website, but in the meantime, they're now listed on a daily basis on the epidemiologic daily report that Public Health Ontario has. And so we will be putting it on our website in terms of the variants related to that. And that's it, Jenna. Can we take some questions from the media right now?
Thank you, Dr. Paul. Merci. Our first question comes from Philip Blanchard, Morrisburg Leader. Please go ahead.
Good afternoon, Dr. Paul. First of all, what school is an outbreak in the EOHU? Because the website doesn't list any. And
you know what? It's over. You know what? It's over. Glengarry District High School. It's over.
Okay, thank you. The second one, there's been a lot of confusion about the rollout of vaccines and who's eligible and what age group and that. We're hearing it from our readers as well. Other than media updates like this and Facebook posts and robocalls, what is the EOHU doing to present clear messaging to the residents, especially since all PHUs have received extra funding from the province to increase promotion?
First of all, I don't know where you got the latter. That's another issue in terms of increased promotion. We haven't received funding for that. However, our goal is to sensitize as much as we can our population. If you go on our website, we have a weekly update that says clearly who's next, who we've done, what we've done. We will be continuing to reach out through our community partners, through as many people as we can to reach special groups, because as you know, phase 2 will have different age groups. And those will be clearly indicated moving forward. The phase 2 will have many different groups, and that's important for us. We're already reaching out to them, and so we will have regular updates on our website, and as much as we can through direct and indirect contact with agencies, schools, and so on, as we get into those swaths. But right now, what we've made clear on our website that it's quite clear that which groups are being vaccinated at this point. It's clear what the next phase is going to be. And as we approach the phases, we'll be having more and more intense messaging going out.
Okay, thank you.
You're welcome.
Thomas Stockton, TVC 22, asks, when the clinics will start vaccinating now that bookings are available, specifically the Jean-Marc Lalonde Arena in Clarence-Rockland?
Okay. We've already been vaccinating, and it's been going on for a while now. We've been vaccinating all over in our 6 areas. The Jean-Marc Lalonde Arena has been retrofitted. There's some renovations. We had a clinic last week at Rockland. I actually visited the Jean-Marc Lalonde Arena, and it'll be ready for this week. We'll be vaccinating effective this week on Friday.
Thank you. Prochaine question nous vient de FM 92.1. Demande, au vu du nombre de vaccins dont la région pourra bénéficier au cours des prochaines semaines, à quel moment croyez-vous que la phase 2 pourra débuter?
Je crois que la phase 2 va débuter fin mars, début avril.
Merci. Do those joining by phone have questions? Press star 6 to unmute. Ceux qui se joignent par téléphone ont-ils des questions? Appuyez les touches étoile 6 pour désactiver le mode silencieux. Those are all the questions for today, Dr. Paul.
Thank you. Merci.